As the governor mentioned, we have 23 additional cases. This brings our total case count to 106. These people range in age from their 20s to their 90s. None of these people were nursing home residents. People in this group reported recent travel to a range of places, including New Jersey, New York, and Utah. None of these people reported international travel. Given the travel restrictions that have been rolled out over the last few weeks, we anticipate reporting fewer and fewer people with international travel histories. To give you a fuller picture on travel, of our 106 cases, 33 had recent domestic travel and 14 had recent international. We are still investigating the travel histories of 15 people, so both of those numbers could be higher. We currently have 4 people hospitalized. We've received a lot of questions over the past few days and weeks about surge capacity at hospitals. We are working very closely with our hospital systems that are doing everything needed to be prepared from a surge standpoint. We are certainly preparing for a range of different scenarios, but I do want to emphasize that only 4 people are being treated in the hospital in Rhode Island right now because of COVID-19. One other data point I wanted to share was the number of people who have contacted us about donating supplies. As of this morning, we have been contacted by 204 organizations or people looking to make donations. We are incredibly grateful for your generosity. I want to again share the website that the Department of Health has activated specifically for this. So this is where you can go if there's anyone else who's interested in donating. Use the online form that we have developed at bit.ly/COVID-19-MSD. That's bit.ly/COVID-19-M as in Mary, S as in Sandra, D as in David. I want to share one other very important message. You have heard this, and it's critical for us to continue to reiterate. If you are sick, please stay home and recover there. We call that isolate. Please stay at home and isolate there. Do this even if you have not been tested for COVID-19. This is important because we have community spread of COVID-19, and it's critical that people know the response that's needed. While home, keep a distance from other people in your home. Stay in a separate room if possible, and use a separate bathroom if possible. Do this even if you are mildly ill. If you need medical care because your symptoms are more severe, higher fever, shortness of breath, or cough that makes it challenging, please then call your doctor. Do not just show up somewhere at a healthcare facility. This is a critically important message right now. Finally, we have heard a lot about restaurants doing takeout and that creating crowds outside of restaurants. We appreciate the cooperation of restaurants throughout the state, but we need people to remember that the restaurant policy we have in place is about preventing crowds. So please do not congregate on sidewalks outside of restaurants. A lot of places are having people wait in their cars and then are calling them when their food is ready. That is a great model. This is a time for us now to develop creative and innovative ways to conduct business. This is what's going to be critical for us as Rhode Islanders. I know that this is new to us all. These are unprecedented scenarios, but we really need everyone to be doing their part right now, and this is something that all Rhode Islanders can contribute to.